Hello, I'm Dr. Smith from Wigston Central Surgery. We wanted to put together a few videos that talk about how we do things in the practice. Our hope is that this will help us to continue to work well together to offer you the best care that we can. Today's video is on investigations and results. When you come down to the practice, it may well be that we want to do a blood test or another investigation to help us get more information about the condition or the problem that you come with. Equally, sometimes we do investigations because of a chronic disease that you might have, and it might be part of the monitoring for a different medication that you might be taking. If it's something like a blood test or a urine test, we'll be able to do that here at the practice. But for some other investigations, like X-rays or ECGs, it may be that we need to send you to a hospital and make an appointment for you to be seen at a local medical setting. Every time we request an investigation or result, it's specific to that situation. It only really makes sense in the context of the problem that you've come with. And so that means that the person that requested that test is also the best person to be able to make sense of it afterwards. And that's the first thing that's really important for us to remember about investigations and results. They only make sense in the context in which they're taken. So what actually happens when a result comes back to us? Well, there's different ways that results make their way back to us. Occasionally, if there's a really urgent problem, the laboratory will actually get on the phone and ring us, and the on-call doctor will make sure that that problem is dealt with that day. But for most results, they come through to us on the computer system, and then they're distributed out to the person who's most likely to be able to help. As I mentioned before, it's usually the person who asked for the test in the first place. Now, when we receive a result, there are a number of ways that we might want to get in touch with you. If we think there's a really urgent problem that needs to be sorted that day, we'll pick up the phone or send you a message in order to make sure you get the care that you receive. But more often than not, when we want to talk to you about a result, it doesn't need to be on exactly the same day. So quite often when we follow up a result, we'll ask our hard-working reception staff to get in touch with you, to send you a message asking you to book a routine appointment to follow up that with us. Now, if your results are completely normal and we don't think that any follow-up is needed, then we wouldn't routinely get in touch with you. It might be that when you've had a test, you know that you're going to want to follow that up with a doctor. If that's the case, we'd encourage you to make an appointment at the time that you have the test. Just make sure you leave enough time so that we'll definitely have the result back by the time that we have our follow-up appointment. For a blood test, we'd say you need to leave at least a week. And for a scan or an X-ray, probably a couple of weeks, to make sure that we've got the information we need when we talk things through again. So remember this with investigations and results. If we need to follow up a result with you, then we will get in touch. But what about when you're waiting for results? We know that can be quite an anxious time. Remember that we as doctors are also patients in our own practices, and we know what it feels like to be waiting for results, especially when there's some uncertainty there. But rest assured that we will get in touch with you in a timely manner. So if we get in touch saying we want to make a routine appointment, you can feel confident that there isn't an urgent problem that needs to be dealt with. Of course, if you start to feel more unwell in the meantime, then do get back in touch sooner. And that's the other thing to remember about investigations and results. We will get in touch with you with appropriate urgency. So today we've been thinking about investigations and results, and there's three main things for us to remember. Firstly, investigations only make sense in the context in which they're taken. Secondly, if we need to get in touch to follow it up, then we will get in touch with you. And thirdly, we will do so with appropriate urgency. I hope that's been a helpful explanation of what we do with investigations and results as we try and provide the best care that we can for you. If you've got any ideas for videos that you might want to see, then do send us an email to wigstonsurgeryvideo@gmail.com, and we'll see you again soon.